genitals, so which is otherwise called pelvic inflammatory disease. So coming to the lower genital infections. So lower genital infections mainly involve the vulva, the vagina, and the cervix. The majority of the infections are sexually transmitted disorders. So coming to the common infections, the herpes simplex virus. So the herpes simplex virus are of two types, type 1 and type 2. The type 1 mainly involves the oropharyngeal region. The type 2 involves the genitals. It is a sexually transmitted disease and mainly affects the vulva, vagina, and the cervix. That is the lower genital part. So initially, they appear as painful red papules, which is about after about 7 to days after the contact. Then finally, they form a coalescent ulcers, and the patient present with white discharge, fever, and lymphadenopathy. And they heal spontaneously in about 1 to 3 weeks, but the latent infection may persist in a regional nerve ganglia. And 2 to 3 cases develop recurrence as well. And it is one of the major cause of neonatal transmission of infection. So this is a microscopic picture. It's a pap smear. So where we can see the finding having a cytoplasmic vacuolations involving the superficial cells. And this is a histopathological section. So where we can see multinucleated Jane cells. So coming to Trichomonas vaginalis. So Trichomonas vaginalis, it's a protozoa. So the patient present with purulent vaginal discharge. And the classical finding is, it's called as the strawberry red cervix. And the inflammation is usually superficial. And this is a microscopy of the protozoa, so which is, it is pear shaped and it has a flagella. Coming to candida. So candidal infection is more common in immunocompromised patients, that is in diabetes and patient on antibiotics, and it's more common during pregnancy. So this is the pap smear where we can see the yeast forms. So coming to Gardnerella vaginalis. So it is a gram-negative. It's mainly caused by a gram-negative bacillus, and the patient present with a green-gray fishy vaginal discharge, which is very foul. Smelling. And on pap smear, the main diagnostic clue is the presence of a clue cell. So in this picture, we can make out so the clue cell. So this is the organisms mainly which is adherent to the superficial cell. So coming to molluscum contagiosum. So it is mainly caused by pox virus. So pox virus is of four types. That is the molluscum contagium virus or MCV virus 1 to 4. MCV2 is sexually transmitted disorder. And in the adults, it's mainly seen on genitals, the lower abdomen, the buttocks, and the inner thigh region. So the diagnosis is mainly by they appear as pearly dome-shaped papule with a dimpled center. So on microscopy, so mainly we can see a viral inclusions. So this is a HND section. So where we can see cytoplasmic inclusions. So which is the diagnostic feature. So coming to PID, that is pelvic inflammatory disorder. So that is there is infection involving the lower genital tract and upper genital tract as well. So the uterus and the fallopian tubes are also involved here. So mainly it is caused by gonococci, chlamydia, and enteric bacteria. So to start with, the infection starts in Bartholin and the periurethral glands, that is lower down, and it extends upwards. And it is a suppurative inflammation seen after 2 to 7 days. And there is involvement of the tubes leading to hydrosalpinx and pyosalpinx. Pyosalpinx means there is uh, mainly pus-filled tubes are seen leading to tubo-ovarian mass. So this is a microscopic picture of acute salpingitis. So where you can see dilated tubes, and you can see a lot of inflammatory infiltrate. So this is in a acute stage. In chronic stage, what happens is all this plicae gets fused, leading to scarring. So what are the complications of PID? So PID, it can lead to peritonitis, intestinal adhesions and obstruction, bacteremia, and it can even lead to infertility. So coming to the disorders of vulva. So we can see inflammatory disorders. The commonly seen inflammatory disorders include psoriasis, chronic dermatitis, and lichen sclerosis and squamous cell hyperplasia. And benign exophytic lesions, that is condyloma acuminatum. And the neoplasias include vulvar intraepithelial neoplasia and Paget's disease and invasive carcinoma. So coming to lichen sclerosis. So in this picture, this is a microscopic picture where you can see there is marked thinning of the epidermis with sclerosis of the superficial dermis, and you can see there are chronic inflammatory cell infiltrate in the dermis. In squamous hyperplasia, what happens? There is thickening of epidermis and there is hyperkeratosis. So coming to benign exophytic lesion, or it's also called as condyloma